Health Alliance plan is 670,000 members, part of the Henry Ford Health System, which is comprised of a large quaternary teaching hospital, community hospitals, a 1,200 physician group, and Health Alliance plan. Well, we've been using the HEX tool for about a year, and we found it to be extremely useful in terms of being the great equalizer. Because until then, when we looked at value for hospitals, really what we were focused on was the unit cost pricing for hospitals and for contracting. And as we looked at the 60-some hospitals in our market and tried to evaluate where we were getting good value with our contracts and where the value was lacking, HEX was a terrific tool in terms of being able to roll up the individual hospitals into health systems and be able to price it to a benchmark that we could readily recognize, appreciate, which is Medicare repricing, and actually in a blinded way share some of that information with our hospitals as well. The MedInsight HEX tool, for me, offers great utility in three general areas. One is certainly with provider negotiation, provider contracting. I think it allows you to enter into an informed decision with sophisticated people on the provider side to be able to arrive at a price that is benchmarked to a known entity, which is Medicare pricing. I think another place where the HEX tool is particularly powerful is in a health plan's own internal work to be able to project trend assumptions for the coming year. It's overly simplistic to just put a unit cost negotiated number or a unit cost number in the trend analysis. The HEX tool allows you to have a historical view at shift in types of services. Case mix severity allows you to look at inpatient and outpatient services and look at what's happening with severity as well. Thirdly, it does allow you more broadly to be able to look at the value of the network and be able to rationalize the network in the way that best meets the needs of your customers. It's difficult for a health plan to go to a provider and just tell them they cost more than someone else or competing providers. Providers typically aren't moved by those types of arguments, but if you can show a provider where they are relative to a benchmark and qualitatively talk to them about where they are in terms of quartiles of highest cost providers, that resonates more with providers. From a chief medical officer's perspective and someone responsible for provider contracting, making sure that you have good data with integrity and making sure that you have tools that translate that data into information, and then most importantly, making sure you have access to wisdom from true subject matter experts who have credibility in the field is something that's not necessarily easy to find, and a relationship over time that allows a team that is working to provide improved access to care, improved quality, improved outcomes. Those types of tools and that access to expertise is something that isn't easy to find and something that I'm truly grateful for.